podcast. My name is Robbie Cassidy, and today we're going to discuss how to reduce back tightness and soreness. Now, as we get into the winter, I always start to notice that more people get in contact with me who are struggling with these issues, okay? And the reason being is that your activity levels in general can drop over the winter. Some people may sway away from the gym, especially as it comes around Christmas. It gets darker earlier, obviously. And because of all that, then we are less likely to get out, keep moving, move around, exercise, and more likely to just sit, chill in for the evening, stick the fire on and watch movies and watch Netflix. Now, just before I jump into this, I will talk a small bit about the work I do at the moment. So if anyone is interested, just reach out and send me a message. But basically, I work with people who have long-term injuries and are looking to get back to sport or an activity, whether that be get back to playing GAA, soccer. It could be that you just want to get back playing, you're doing a kick around with your friends. It might be that you want to get back hiking. Or it could be that you're out of the gym for a long time because of an injury and you want to start easing your way back into it again. So what I do with people is we work on improving strength, mobility, changing beliefs. We also work on breathing exercises and getting a better understanding of what may be contributing to your issue at the moment, and then how to reintroduce yourself back into sport again. Obviously, that goes along with that. You also have a lot of education around sleep, around hydration, around stress management, because all these things can play a huge role in flare-ups, and if we don't address them, you're going to have different issues down the road. So if anyone is interested, just send me an email, or you can get in contact with me. There's a form on my Instagram. You can fill that out and we can talk about it or discuss it in more detail. But to jump right into it today, I guess what we'll start off with is, why do so many people struggle with back pain and tightness? And I did touch on it at the start there. Well, really, this time of year, you're obviously going to have, as I said, your activity levels are going to be dropping in that. But in general, people have it all year round. And it could be due to, let's say, people sitting at a desk and not getting enough movement in. And I should say, clear that up. There's no problem with sitting at a desk and working at a desk, as long as you're getting moving every once in a while and changing your position to give your body a chance to relax. You don't want the same muscles working all the time, or they will, in general, fatigue. Okay, so as long as you're changing your position every 15-20 minutes, it's not that much of an issue working at a desk. But what happens to people is they get stuck in this mode of, let's say, they're fatigued and tired and they're trying to get something done on the computer or the laptop. And I know this feeling because I get stuck. It happens to me all the time. And you just sit there staring at the screen, and just kind of all your energy is on the screen and you don't think about anything else. And you could do that for 1 to 2 hours or 3 hours just because you're fatigued, and it's just your concentration isn't there. And I guess you're nearly dozing is the easiest way to say it. So that is a huge one that I notice myself, and I notice a lot of my clients talk about, is that they just lose that sense of, that sense of awareness that they have to move. And just sitting in the same position all the time is going to be the issue. And there's going to be an issue. And this is why people have an issue with, let's say, sitting in general, is that they think that sitting is bad for you, but it's not. It really isn't. It's the lack of movement and lack of varied movement that's bad for you. And if you can squeeze that in throughout your day, you can really fix that. And then other reasons people struggle with back pain and tightness is activity levels, lack of movement, lack of confidence, fatigue, lack of strength. In general, the body only ever gets tight, or it causes an area to get tight, if it's uncomfortable or it's lacking confidence in that area. Okay, and it's not the body. It is a body, but it's the nervous system more so than the body. Okay, so the nervous system, when your brain starts to figure out, okay, well, let's say I always use the example of somebody who has a shoulder injury or who's dislocated shoulder. They'll find it very difficult to get into externally rotated positions where they're, let's say, reaching behind their head to tie up their hair, or they're reaching back for something behind them. Maybe it's like something in the backseat of a car. Reason being is that it puts their shoulder into a compromised position. Their body remembers that from when they dislocated it initially. So instead of letting you back into that position, everything gets very, very tight. So that's a simple way of doing it, simple way of explaining how confidence is a huge thing. If the body was very confident in that position and it knows that it can get in and out of that position with ease, then it will allow you into that. And that's the basis of all mobility training, is just building confidence in the body to let you into certain positions. Okay. Now, other reasons that you would lack confidence or lose confidence is weakness, obviously. If you're weak around an area, that's going to, your body won't be as confident going into that position. It'll be uncomfortable going into that position. If let's say if you're tired and fatigued, your body will not be comfortable going into that position. That also plays into the weakness side of things. You won't have the same strength, you won't have the same coordination, and it doesn't want to put you at risk of injury. And as I said, strength obviously is a huge one. So strength, fatigue, lack of confidence, low activity levels, these are all things that play into back pain and tightness. If your activity levels are high, you're going to be a lot more comfortable, a lot more confident moving into positions, and you won't need to be tight. But if your activity levels are too high, that you're fatigued all the time, you're not sleeping properly, well then that will also cause it. So it works on both ends of the scale. Now, when it comes to back pain and back tightness, there's also a huge social issue or psychological issue to it as well. Okay, and beliefs are a massive thing when it comes to any injury or any long-term injury especially. Reason being is that if you believe that, if you have a mindset of a fragile mindset, that you believe that the body is fragile, it breaks easily, and if it breaks then you are screwed, for lack of a better word, for a long time, well then any injury that you get is going to stick around for a lot longer than it should. And the reason being is that your body is in an overprotective mode for a long time. It just stays in that protective mode, and it does that because it works both ways. As I said at the start there, how comfortable you are and how confident you are in a position or with a certain joint will depend on your emotions around that area as well, and your beliefs around that area. If you believe that you have injured, let's say, or if you've injured your knee before and you believe that that knee is weak or that you have a bad back, well then you're going to get a lot more pain and a lot more tightness around that area because you believe that. And your body will also record that, and it will change how it manages that area. So I guess beliefs play such a huge role because people speak to themselves and they speak to others, and I hear this all the time with clients when they say, I have a gammy knee. It's another one that I always hear. I have a bad back. My family have always had bad backs. Is a huge one. I have a very unstable shoulder, a weak shoulder. Anything like that. My hips are completely caught. Tight's very severe. I can't move them. That's another huge one. Things like that what they're doing is they're basically making it out to be a small bit worse than what it is. And it's not even that they're meaning to. They're just using certain language that they've heard other people use, and they are fitting that into their lifestyle. And then because of that, then body will start to adapt to that and change to that, and then things will get that bit more severe then. So beliefs are huge when it comes to back tightness and back pain. And if you believe that you have a bad back, and if you believe that you have these issues, well then they will stick around for a long time. Now, how, as I said, they're a huge part, or they play a huge role in rehab and the rehab process as well. But how you speak to yourself is going to be a massive one. So I would always say you need to watch how you speak to yourself. When you are talking to yourself, you need to critically assess what the issue is actually like. Okay. Is your back tight because you were training last night, or you were deadlifting, or you were doing some type of pulling exercise or squats or whatever it was? Is that one reason that your back is tight and it's actually fatigued? So instead of you saying, okay, Jesus, it's absolutely one that I always hear is I'm crippled with back pain or back tightness. It's so severe, it's so bad, I can't move. I can't move is what I hear all the time. And they're exaggerated. I guess people are exaggerating their experience in a way, not meaning to, but they want their point to get across and they want somebody to listen to them. And the thing is, as I said, that language will be internalized and can change how you actually feel. So we need to be very careful about what we say and how we talk about ourselves. It's not going to do it overnight, but if you have these repeated narratives or recurring narratives over years and years and years, well, then they will become a reality very soon. So I would always say to look at just how you speak to yourself and how you can change that. Now, when you are talking to yourself and you are looking at your beliefs, where did you pick them up from? Becoming aware of that is a huge one as well. Did you pick them up from, let's say, your father or your mother, maybe your uncle or somebody you admire? Somebody might have told you, don't ever lift, well, I'm sure they have, don't ever lift with a bent back, always lift with your legs. Well, that's just not realistic, because if you have a pair of shoes on the ground, you're not going to squat down to pick up a pair of shoes. You're going to bend over and pick the shoes up. Okay, so we need to be able to bend. Our back is extremely robust and we need to be able to bend. And if we don't, or flex, I even should say, if we don't feel that we're able to do that, then you're going to have issues down the line when you need to do that, or when you drop a pen and you go down really fast to pick it up, and then you stand up straight. For someone who doesn't have the belief that they shouldn't flex their spine, they'll be grand. For someone who has that belief ingrained in them, at times they can get a spasm in their back from that, because they've fallen outside of what their beliefs are, and their body will then react to that. So you'll start getting back spasms, back pain, back tightness. And that's why you hear a lot of the time about people who are, let's say they might have worked 10 days or 14 days in a row. They're really fatigued, their sleep is poor, their diet has gone to shite, they are, sorry for cursing, their, let's say, hydration, they're dehydrated, they're extremely stressed, and then they wonder why they just dropped something on the ground, went down to pick it up, and their back went into spasm, and they were in bed for 2 days or 3 days after it. Okay, that is not a normal physiological response to anything. When you go back to survival, it's not optimal for survival to be having to be sitting down for 3 days after getting back cramps. So that's because they've fallen outside of their beliefs. Now this will have a huge effect on their body, and their body will react accordingly when you break that belief, I guess, or when you go against that belief. So it takes a small bit of time to change those, and it is huge. It's such an important aspect of rehab. So that's one of the main issues, or why beliefs play such a role. They change how we move, they change how we hold ourselves. If your father walks a certain way or your friend walks a certain way, you'll start to walk that way. Good example, if you look at Conor McGregor, the way he walks, and then you look at the way young lads walk around Dublin now, or young lads walk around Galway, a lot of them have adopted that same posture, and it's very common. You'll see that if a big sports star, if a big star walks a certain way, and someone who admires them, they will change the way they hold their posture. So it's not posture is the issue anymore. It's their belief of what they should walk like, how they value. That's what changes their posture. So that's not a good or bad thing for the body, but it's basically an adopted posture. So once we get an understanding that we do pick up beliefs from other people, other things, and we I guess fit them into our lifestyle or adapt them to our lifestyle, that can change how our body reacts. And bringing this all back around to back tightness again, we need to look at, I guess what I'm getting at is you need to become more aware of where you've picked them up and why you have that belief. And if you become aware of it, then it's a lot easier to change it. If you're not aware of it, it's difficult to change something you are not aware of. Another issue that I wanted to kind of highlight with back pain and back tightness, why do so many struggle with it? Well, as I said, there's a social thing there, the severity of it. In a general sense, if you hear of someone who has a spinal injury, you fear the worst, in that in general there's a big possibility that that person has become paralyzed from a spinal injury. So having a back issue very quickly gets related to that. And having an issue with your back and your spine, people at times will link back pain to a spinal injury or spinal pathology at times, but they will group it all together. And when you group these things together, as I said before, the brain is in a cave. So it just picks up on what you feed it in. And if society thinks that back pain and back injuries, because a back injury, the groups, it takes everything into account, from a muscle tear to a ligament injury to a bulging disc touching off a nerve to a severed spinal cord to a fractured vertebrae. So back injury, the word, covers a lot of things, and it's such a debilitating area to injure. When you look at the spine and the spinal cord, that translates, I guess, to a higher level, that people start to associate anything to do with a back injury with the worst possible outcome. And when that's fed into society, and you see people all the time saying, don't lift with your back, don't bend down, you need to wear, or your posture is bad, you shouldn't be sitting all day, you need to wear a brace going around, you need to wear a neck brace, or you need to wear whatever it is. When you start to get that, and that starts to feed into society, then people start to develop their own beliefs. And when you start to develop your own beliefs, or you pick it up off, let's say, people who you look up to or you respect, that will change, as I said, and as I keep coming back to how your body reacts to these things. So there is a huge social pressure there as well with back pain. There's a huge social issue there with back pain about the severity of what it can be, as opposed to what the majority of people are struggling with, and back tightness. So when that's always in the background, having a tight back becomes a bigger issue. It's not just, oh, my back is tight. It's, oh, Jesus, there's something wrong with my back. And then that tightness gets more severe because you're feeding that into the body. So I guess first I should say, I hope that makes sense to people about why it's a social issue, why it's a psychological issue, and how you have to address all those other things to really have a good outcome with this. Now, in general, back tightness isn't a big problem. It's, okay, my back is tight the same as my hamstrings are tight, my calves are tight. You have to do certain things to get over that and to improve it. But just watch on what level you treat that. Are you treating that? Are you catastrophizing and making it as bad as it could possibly be? Or are you being honest with yourself, becoming aware of why you think, or why you have certain beliefs around it, and then looking to control it yourself and or take control of it and reduce that tightness or reduce that pain and take control of the lifestyle factors that may be contributing to that, instead of sitting back and looking for passive modalities like, let's say, foam rolling, going for massage, dry needling, different things like that. Now, I guess moving on from there, how do we improve it? Well, first off, you need to look at the factors that are contributing to why you have pain and tightness. And as I've touched on, and I won't be going back into it again, I don't want to go back into it, the belief side of things. That's a huge factor. So when you've addressed that and you've addressed where that comes from, and sometimes it can be difficult to do it. Sometimes you need help actually figuring out where it's come from and why it is there in the first place. So in those situations, you may need to reach out to someone and ask them about it. But outside of that, then you need to look at building a consistent activity or exercise routine. Now, what does that mean? Well, I would say that you should be active for over 30 to 60 minutes a day, 5 days a week. That's what the WHO recommends as well. And you should be looking to mix strength and resistance training, get some form of cardiovascular training or endurance, and then having a nice mix of mobility and movement stuff, just to get kind of an overall view of it. Now, what I would say, with a lot of these things, you can do it by entering some type of a sport, whether that be playing Astro, it could be playing volleyball, it could be that you are, let's say, playing handball, it could be that you are playing tag rugby, running with a running club or hiking with a hiking club. These are great ways of improving endurance while enjoying the activity at the same time. And if you enjoy it, you're going to be more likely to stick at it. So all of those are very, very effective ways of getting your activity levels up, but they also are enjoyable. So look and find what works for you, and then look to as I said, incorporate some type of a mobility and movement routine where you do it at home. You can incorporate that with your mindfulness routine if you want to, because a lot of the time these mobility routines are very low level, so they're very light, and you're not going to give yourself, or you're not going to have too much bother getting through them. So that's why I say that building that routine can help with longevity, and it'll help you reduce this back pain and back tightness when it kicks up. So look at different ways that you can test the back. Like with the sports I've mentioned, they're going to test it. They're going to stress it, and it's going to, when you stress it and you give it time to adapt, that's when you really reduce the likelihood that this happens. So things like running, jumping, swimming are all huge, very, very effective ways of testing it. It might be that you have to start slow and build it up if it's something you've struggled with for a while. But they are things that they're basic movements that you should be getting into your routine. Then I would also say, and this is the most underestimated thing that I always introduce with clients, is work on basic movements more often. Okay? What does that mean? Well, it means like work on going down and touching your toes, extending, rotating, reaching to the opposite toe, maybe reaching overhead. Work on all those basic movements so you can do them. You won't look like a crazy person doing, well, you may if you start throwing down a lot of mobility exercises in an office if you're working there. But in general, if you start doing these ones, it's more acceptable in a way, and they're also extremely effective. Okay, you can do them at any time, and they take very little effort to go through them. So I would definitely say look at including more of those in your day. Now, what I would also say is focus on reducing fatigue, because if you have a lot of fatigue, it's going to really affect any area that has high sensitivity. And if your back is an area that you've struggled with in the past with tightness or with pain, well, that's going to mean that means that your sensitivity is going to be pretty high around that area. And I've talked about sensitivity extensively in other podcasts, so I won't dig into too much of this, but it's basically if you have an area that's been injured before, if you have an area that you have a lot of conscious awareness around, the warning signs or the pain signals for that area can be turned up. Okay, and look at, I have a podcast, The Pain Experience. It's my first 3 to 4 podcasts where I go into a lot of detail on that, but if you've listened to many of my podcasts, you'll hear me talking about it a lot. And you need to look at taking down that sensitivity. So if the sensitivity is high, once you get fatigued, that's going to start kicking up. Once you get stressed, that's going to start kicking up. If you get dehydrated, that will start kicking up. So first off, you need to improve your sleep, and there's loads of ways you can do that. I would say the first thing is to get a consistent sleep and wake schedule, and what has worked for some of my clients and what's worked for other people is setting an alarm when it's time to go to bed. Because it's a different perspective on setting an alarm when it's time to get up. Okay, everyone does that, or a lot of people do that. But setting an alarm when it's time to go to bed can be as effective in that it's time to get everything shut off, or 15 minutes before you go to bed. It's time to shut everything off and actually start going through my routine, whether it be brush my teeth, turn off all the lights, lock the door, feed the dogs, whatever you do. At least if you have an alarm there, once it goes off, you know it's time to get to bed, and it's a very effective way of structuring that schedule that you go to bed at the right time and you get up at the right time. Hydration, huge one. As I said, if you're dehydrated, it's going to be very difficult for you to do anything. You're going to be fatigued all the time. Your concentration is going to be poor. So you need to look at hydrating yourself as much as possible. It's funny, whenever I talk about hydration, and this is probably why I, in general, stay fairly hydrated, whenever I talk about it, because I talk about it on every single call with clients. So nearly every call I talk about hydration, or I ask them how it is. And when I do it, when I talk about it, I always reach for a bottle. So I always have a bottle around me, a 2-litre bottle to my left here, a cup of coffee to my right. I was reaching for the coffee that time. But if you have a bottle in your vicinity, and then you connect hydration to something else, it will make you drink it more. So if you are thinking about your gym session that evening, if you have a bottle of water beside you, you're more likely to pick it up and start drinking about it, or drinking out of it. If you know it's coming up to lunchtime, it could be a good thing to keep that beside you and start drinking it every hour on the hour is another effective way. I say to get as much of it in early in the day as opposed to late, but keep the bottle around you and you're going to be more likely to drink it. One little pro tip on that is if you drink a lot of water in the morning, like if you drink a liter of water in the morning, then you're going to be more likely to drink a lot more of it throughout the day, because you'll just be in need of it. But if you leave that till later in the day, you're less likely to drink it because you're more used to not having water around you. So that's one that I would say to definitely get in more often. Is if you get water in, you'll see a huge change in your energy levels first, but also because you'll be less dehydrated, but you'll also see a huge change in your mood and the amount of tightness that you have. Because any joint needs lubrication as well. And if it doesn't have enough water, you will find that lubrication, or you'll find that for longevity purposes, joints will break down quicker, or you'll get more wear and tear. So we need to look at that. Diet, another huge one. We're really just looking at the main things. Staying off processed foods, which is probably the same for across the board. Keeping your protein at a level that is sufficient to sustain your training levels. If your training levels are high, you want to keep your protein high so you can continue to train at that level and recover. Then really what I'd actually be looking at as well, but I won't talk about it in this one, is fasting is very good for you. And little note actually that I'm going to leave in this podcast here, and I know this is about back tightness, but they find across body, if you take something away from people for a small while, and then you reintroduce it, that's the best way of doing it. So if you stress a system generally, and then you give it time to adapt, it gets stronger. Now, where's he going with this? So they know what happens. They know it with food. They know it works. If you stress it with exercise, that works. If you do stress it with cognitive stress, like that you're trying to study something, that works. So I'm going to put this out there now, that I feel that if you do that with other things in the body as well, and there'll be people now who'll be against me considering of all the things I just talked about there with hydration, I think there should be maybe times that you do reduce the amount of water that you take in at different times, because it works for everything else. So why wouldn't it work for water? But I'm just going to leave that there, all right? I'm not going to go into too much detail on it, but I'm going to talk about that in more podcasts as we go forward. The same thing with everything else. Pull something away, bring it back, the body gets better at it and it adapts it more. So I'm going to have a real think about that, how you would safely do that to get the best out of it. Okay, so don't anyone go doing anything crazy there. Keep your hydration levels high at the moment. I'm just putting that in as a pro tip because I would be contradicting what I say across the board, or I would be a hypocrite if I didn't add that in there, and if I said that you're just supposed to take on water all the time. So I'm just going to put that in at the end as well, or kind of a little, just slide that under the carpet for now, and I will come back to it again. This is the mind of a master procrastinator, just jumping from one topic to another. But anyway, back to it. Stress is the next one. When you're looking at reducing back tightness, you need to look at your stress. If you're stressed all the time, you're going to be fatigued. Your body is going to be on high alert, which will put your sensitivity very, very high. So keep your stress down. Do simple things. Look to get out in nature. Enjoy time with family and friends. Do the basics right. Sleep properly will help you manage stress better. Take little times during the day that you sit back and recover. And I have a podcast on that. A couple of podcasts ago that I go into more detail on it. But in general, what you're looking to do to reduce back tightness is you need to change your beliefs around it. Change your awareness of your beliefs and why they're driving that tightness. Do you feel that having a certain posture is going to cause you more pain, or is it going to cause you a lot more tightness? Most likely it's not. As long as you're varying your movement throughout the day, you're usually good to go. Outside of that, you also need to look at building a consistent exercise routine where you include mobility and movement, strength, endurance, and activities such as running, jumping, and swimming. Also look at your basic movements like touching your toes, rotations, aiming for the opposite toe, extending, reaching overhead, whatever it is. Make sure that you're getting the spine moving in all its weird and wonderful ways. If you do that in a general sense, the body doesn't need to protect it. It'll be comfortable moving around and you'll be able to reduce that tightness yourself. So they're the basics. Focus on reducing fatigue and stress and give the body a chance to heal when you stress it. So look at your recovery after that. But that's the basis of it, guys, really. And girls, there is so much more that we could go into, and we could break each of those topics down in a lot more detail. But to leave it at that, because I'm just noticing we're hitting the 30-minute mark now, to leave it at that, I think everyone needs to just pick one of those points out of that podcast and focus on it for the next week. or even for today only, and then you can go tomorrow and focus on another one. But for now, I'm going to leave it. I won't talk too much more on it because I don't want to take too much more of your time. But guys, I'm going to say thank you so much for listening again this week. I really, really appreciate it. If you know somebody who you think would take a lot from this podcast, I'd love if you could just send it on to them. So just hit the share button and send it on to them on WhatsApp or whatever it is. But that will go a long way in promoting the podcast. It'll give me a better idea of what topics you want, because people are reaching out to me now talking about different topics or different podcasts about different ones that they're interested in. And it helps me decide what ones I want to go forward at and which ones I can include in other podcasts or different aspects of a podcast that I can include. But definitely do reach out to me. Let me know what you feel or what you're thinking, even if it's just to say, I enjoyed this part of that podcast, or I have a question on this, or I don't care, to be honest. If you're going to argue with me on one side of it, grand. I don't mind that either. But just reach out anyway and we can chat about it. But other than that, if you're listening to this on iTunes, I would love if you could subscribe. If you're listening to this and leave a rating and a comment, that goes a long way in promoting it. I would also love if you were listening to this on Spotify, if you could subscribe as well, or YouTube, whatever it is, subscribe to that. I have a weekly newsletter that comes out, and this month is going to be focused on stress, understanding stress, getting a better idea of how to manage stress. So if anyone's interested, go into my Instagram profile, click on that link, and it's only every Friday I send it out. Sign up to the email list. It's just like, I'll be honest, I'm not going to spam you with emails. I'm not going to send you emails every or 3 or 4 times a week, because I just don't have time to do it at the moment. So it's not something that I plan on doing, and it's not something that I would enjoy doing. But I send it out every Friday. I've been getting a good response from it. Sign up to that, and I'm sure you will take something from it. At least you'll always have it there to go back to as well. They're very short emails as well. But yeah, that's the basis of it. If anyone is interested in working with me, reach out. I do consultations for injuries. Let's say if you have a short-term injury, let's say like a hamstring injury or an ankle sprain, or if you have something that's gone on a long time. That's my real focus at the moment with clients. If you've back pain that's gone on for years or months or years, and you're just struggling with it, with bulging discs that are giving you trouble, or you've been diagnosed with something like degenerative disease and you're finding that's giving you trouble, then just reach out and we can talk about it. We can talk about different options. The same thing if your shoulder, your hip, your knee, whatever it is, if it's at you, let me know. I'll at least give you a couple of options on what you can do yourself, progress it, and then if you want my help after, we can work, or we can talk about how that works. But that's everything from me, guys. I'd love if you could share it on your story, last one, and that helps a lot. And I will thank you all again for listening. So I hope everyone out there is well and happy, and yeah, that's it. So have a good one.